In Great Yarmouth, our main challenges are looking after a population that in the villages is elderly and frail, largely made up of a retired population, and in our urban centre areas of very high deprivation. So the challenge is to ensure that our service can meet both those two extremes. One way that we wanted to look to meet those challenges was through more integrated working with our community services provider and indeed other practices locally. So to try and tackle these challenges and to meet the requirements of the GP Forward View, I became aware of the Time for Care programme run by the Sustainable Improvement Team from NHS England. This was really attractive to me because it allowed us to access external expertise to help us to bring together the solutions we needed to meet the challenges going forward. When we looked at what was on offer, there were three distinct programmes. There was the Learning in Action programme, first of all, which apart from giving us access to independent external experts, enabled practices to come together to look to provide solutions for their challenges together. There was also the Productive General Practice Quick Start programme. This was particularly attractive to us because we had looked at previously trying to bring in theories of work that are used in commerce. And obviously, to ensure change is successful, it needs good leadership. So we felt it was important for our locality GP lead to embark on the General Practice Improvement Leaders Programme.
At East Norfolk Medical Practice, we had identified that 25% of GP appointments could have been dealt with by another organisation, such as the pharmacy. We decided to participate in Learning in Action to see if we could find a solution.
Yes, what's the name, please?
At the 10 high impact actions, we decided to focus on active signposting. We had 4 workshops altogether and decided to tackle referrals to pharmacy. We used a technique called process mapping. This gave us an opportunity to look at the whole process. We also used the Plan, Do, Study, Act cycle.
Good afternoon, you're through to Lindsay. How may I help you?
We would not expect receptionists to make clinical decisions, so we had to agree with our local pharmacies, the CCG, doctors, and we even included our patient participation group in the final decision on the conditions that we were going to refer to the pharmacy rather than giving a GP appointment.
Lovely. And can I just ask you what's the problem, please?
Now, if a patient phones, says they've got a sore throat, the first question that the receptionist would ask is, have you seen a pharmacist for this condition?
They may be able to recommend a treatment that you can purchase over the counter.
One of the other things that we did as part of this programme at our practice was to remodel our phone answering system. And this enabled us to reroute our calls more directly, which enabled us in the first month alone to reroute 800 calls more directly than previously would have been the case, ensuring that patients' calls were responded to more quickly and they received a more effective outcome.
Based just on the last 2 months, we've managed to release 146 appointments, GP appointments, and that over a year is 876. which equals 146 hours of GP time released per year.
With the changes in the NHS that are happening at the moment, it was clear that we needed to start working together as scale. Come in! I became the lead GP in our locality of practices. And so myself, along with the practice manager, have been in the position of needing to drive the changes forward. And therefore I thought I'd better develop my skills, and I joined the General Practice Improvement Leaders programme.
I'm not too bad.
Everyone who joins this programme does come along with a specific project in mind, and my project was really how I can start this working at scale together. Change is difficult, and I don't think really, although we may be the leaders of our organisations, we don't necessarily as GPs have the right skills or training or experience in moving things forward in a larger scale. I'll be seeing you again in another 2 or 3 weeks. The programme taught us about the change model, which does have shared purpose as its centre. It's really key that people understand why we're doing what we're going to do before we start thinking about the details. I think through the programme I have learnt specific skills and techniques that I can use when presenting, when leading small groups and planning projects. I was given this role and I really thought, am I the right person for this? How am I going to take this forward? Has my 30 years of medical training really prepared me for this? And I think it's given me confidence.
Here at the Nelson Medical Practice, we chose to embark on the Productive General Practice Quick Start programme.
Nelson Medical Practice, Peter speaking, how can I help?
One of the modules that we used was the Efficient Processes module. And the reason why we chose that is because we identified that our hospital correspondence and scanning process was defragmented. One of the tools that we used was the process mapping. We were able to look at the process, what we currently did, and tweak it to what we wanted it to do. We identified that 1 or 2 members of staff were stamping a document 2 or 3 times. So when we reviewed the process and took those steps out and used the electronic scanning process, which is built into the clinical systems, we were able to remove all those steps. And also we identified that a number of hospital correspondence didn't actually need to be sent to the GP. It wasn't an effective use of the GP's time to see documents that didn't really give any clinical information for the patient. So that also could be removed from the process. When we looked back on it, we identified that we'd saved 1.5 hours a day, which ultimately came back to 390 hours over the working year. We actually couldn't believe that that was actually going to save us that amount of time.
To take the learning and skills from external experts and then be able to embed them in our everyday work is really important. One of the main successes is that it's really helped to ensure great communication across all of our practices and a real desire to work together.
It's not always visible to the patient's eye what we've done. However, processes are a lot more efficient now, they're a lot more streamlined, and that has to be a benefit to patients.
I like to think that now patients who would have in the past phoned up for their sore throat or a cough or a cold won't even phone the GP surgery now, because it's like a patient education, and they now may automatically go to the pharmacy first before coming to the surgery.
All right, thank you. Although there may be an investment in time to attend such programmes, it's useful because you have a clear headspace, you can really think about how you'd like things to be in the future. The networking opportunities are really excellent, and then you can take back to your practices or to your localities or areas ideas that will in the end make your daily life easier.